we're going to discuss about beta blockers. I would like to remember it as two small b's. When you flip around, you get OLOL. So we've got three generations under the classification of beta blockers drugs, also called as beta adrenergic blocking agents. First is first generation non-selective, second selective, and third are the ones that also blocks alpha receptors. But before we start, we need to know the basics. That is, beta 1 receptors are usually found in heart and kidney. Beta 2 receptors are found in lungs, peripheral blood vessels, and skeletal muscles. And beta 3, fat cells and bladder. I would like to remember it as, since we've got one heart, beta 1 is found in heart. And we've got two lungs, beta 2 in lungs.
So have you all seen the bars on top of your phone screen indicating the signal strength? So you'll see the kind of mobile network you have on the phone next to that is 1G, 2G, 3G, 4G, etc., right? So I kind of relate the beta blocker generations to that of the mobile network, as in 1G, we have very less facility. So it is basically non-selective. Whereas in 2G, it is a bit more advanced with the facilities. So it is a bit selective, okay? And 3G has enhanced feature of blocking the alpha receptors. So 3G again, better facilities. So 1G non-selective, 2G selective, and 3G with alpha blocking or vasodilator properties. So the non-selective has both beta 1 and beta 2 antagonist effect, and you can remember it as anything that falls from O to Z comes under non-selective, okay? So to remember the classic examples given here, I made mnemonics. Parents take son's pizza. Propranolol, timolol, sotalol, pindolol. Now selective, we have anything that starts from A to N, okay? And this has got beta 1 antagonist effect. So we have the mnemonic that goes like, making awesome apple brownies eagerly. Metoprolol, atenolol, acebutolol, bisoprolol, esmolol. Certain beta blockers that does not have the classic olol suffix but has an alpha antagonist comes under 3G classification. But you have to also remember that not all the drugs under this are different. Now the must-to-know drugs under this are labetalol and carvedilol. I use the mnemonic LESSI to remember this. Other than these two, there are other drugs. So basically I use the mnemonic looks cool, cooking nice breakfast to remember the other drugs with this. That is labetalol, carvedilol, celiprolol, nebivolol, and beta-axolol. So there are other drugs, but these are the classic drugs that you need to know under this classification. Before going further, let's revise the classification mnemonic once again. Parents take son's pizza, making awesome apple brownies eagerly, looks cool, cooking nice breakfast. First is the ones between O and Z, propranolol, timolol, sotalol, pindolol. Second is the ones between A to N, metoprolol, atenolol, acebutolol, bisoprolol, esmolol. And 3G, labetalol, carvedilol, celiprolol, nebivolol, beta-axolol. Now in this, sotalol is an exception. Even though it does not have olol, it comes under non-selective. Now moving on to the cardioselective beta 1 blockers, we've got metoprolol. It is metoprolol, it is not metoprolol, atenolol, nebivolol, bisoprolol, acebutolol, beta-axolol, esmolol, celiprolol. Now you'll ask me how to remember all these things comes under cardioselective beta 1 blocker. We've got the mnemonic man bakes. Okay, C is an extra. We need to add it somewhere to remember it, okay? Now in this, you can see nebivolol and celiprolol. It comes under third generation beta blockers. Nebivolol and bisoprolol are the most cardioselective beta blockers out of these. And celiprolol has got beta 1 antagonist activity with a partial beta 2 antagonist activity. Now how does beta blockers work? It works by blocking certain chemicals in our body. Next, we're going to discuss the important points that we need to know under beta blockers. First of all, heart rate, force, cardiac output, cardiac work, oxygen consumption, and blood pressure. Everything decreases when you take beta blockers. In kidney, beta blockers inhibits the beta 1 adrenergic receptors on juxtaglomerular cells, which causes the renin release. So the blockage of these receptors, it will decrease the renin secretion, leading to lower the levels of angiotensin II, which is a vasoconstrictor. Therefore, it decreases the aldosterone secretion, causing vasodilation, reduced blood volume, and lower the blood pressure. Now, the longest acting beta blocker is nadolol. 14 to 24 hours is its acting period, and shortest acting is esmolol.
It is a very important question, can be asked for NEET exam. Its plasma T-half is less than 10 minutes. It's used as a continuous IV drip. Now, lipid-soluble beta blockers are labetalol, metoprolol, pindolol, and propranolol. I use the mnemonic LAME PIN PRO. And water-soluble beta blockers are atenolol, sotalol, celiprolol, nadolol. And these are cleared by the kidney. And I use the mnemonic SONA 8 Celi. Now, lipid-soluble beta blockers are really important for your exam. Propranolol has extensive first-pass metabolism, thus they have low oral bioavailability. And its chronic use will cause decrease in hepatic blood flow, therefore increasing the bioavailability. Now, beta blockers, it will affect the bronchi and will cause bronchospasm. It is contraindicated in patients that has asthma or COPD, that is chronic obstructive pulmonary disease. And also the chronic use of first generation beta blockers will result in decrease in HDL and LDL ratio, causing increase in the risk of coronary artery disease. Now, moving on to the uses. Always remember beta blockers are related to heart, okay? So remember the conditions that is related to heart, such as hypertension, angina, arrhythmias, MI, congestive heart failure, aortic dissection, etc. Okay, and other than heart diseases, you can remember it is used during essential tremor, glaucoma, hyperthyroidism, that is overactive thyroid, anxiety, pheochromocytoma. So you should avoid beta blockers in such kind of patients as listed below. Asthma, arrhythmias, low BP, Raynaud's phenomenon is nothing but a problem that is caused due to decreased blood flow to the fingers due to spasm of blood vessels in those areas. Hypoglycemia, as you know, low blood sugar. So you should avoid beta blockers in such cases. Next, you need to know which all cases these 4 drugs are predominantly used in, such as carvedilol. It is used for congenital heart disease, atenolol, hypertension and angina, timolol in eye for glaucoma, propranolol, migraine. It is most effective drug. Thyrotoxicosis rapidly controls the symptoms without affecting thyroid status. So that's a wrap on beta blockers. Thanks for watching, and don't forget to practice reciting these mnemonics before your upcoming exam.